Hello, everybody. This is Dr. Bob DiMaria with another Ask Dr. Bob from Westlake, Ohio and Naples, Florida. You can come and see us anywhere in the world. We always enjoy visitors and friends. Dr. Bob, does prenatal, I've been thinking product, have an effect on constipation in your thyroid? So anytime that somebody has they're pregnant, it could really throw their body off. I've not heard of prenatal supplements unless they have iron in them, create some of those distresses that you're talking about. So I hope that answers your question. Dr. Bob, gastritis since I had a baby 15 months ago, still breastfeeding, is it hormone related? What I have learned, when ladies have babies, those babies place a demand on your liver, and your liver gallbladder mechanism can be literally thrown off. I would encourage you to get either Dr. Bob's Drugless Guide to Balancing Female Hormones or Dr. Bob's Drugless Guide to Prevent Surgery, the surgery book. I have a chapter there just on gallbladder. You want to make sure you get that liver gallbladder mechanism going because you do not want to have your gallbladder removed. Dr. Bob, is it okay to put your body in ketosis to lose weight? You know, there's so much controversy about that. It is supposedly an easy way to lose weight. You're placing a huge demand on your liver with that. I think you have to do this in an individual basis. I did have somebody that did go into ketosis, and she ate so much of the fatty type of foods, etc., and she ended up having a small heart attack and was in the hospital because her body really wasn't ready for it because her liver was compromised. Dr. Bob, taking T3 to lower TSH. I'll say that again. You must be taking T3 to lower your TSH. You're avoiding T4 due to recent cancer studies. Well, we have found that the best way to lower your TSH is to support the thyroid. We use a neonatal glandular product, but because of my agreement with Biotics Research Corporation, I cannot make any recommendations of what you should do unless you have a thyroid panel, which we now have available on our druglessdoctor.com website. So I'm just following the recommendations of Biotics Research Corporation, but we can lower your TSH. What can help take away the yellow horizontal lines in the whites of my eyes? You know, yellow lines are usually liver, could be pancreas stone, could be a gallbladder stone. You really want to have some blood testing done to check your enzymes to see if it could be a pancreas issue. Dr. Bob, can I substitute Armor for iodine to get my T3 in range to 3.6? I think that's what you're asking me. Or what is healthy T3? You know, there's a level called triiodothyronine. The range goes from 80 to 180. We want you to be at 130. It all depends on if your body is making T4. A lot of people make T4, but it cannot get converted to T3. So I would encourage you to get Dr. Bob's Drugless Guide to Balancing Female Hormones and read it and have a complete thyroid panel done to see what's happening in your body. Dr. Bob, I had right shoulder and knee pain, and now it's on my liver and I'm working on it, but tell me about left shoulder pain. We have found that left neck and mid-back pain is a pancreas referral because of its embryologic origin. 99% of the patients that come into this office have left neck and mid-back pain because they love sugar and yogurt and ice cream and cookies and pineapple and bananas and anything sweet. Last question. I recently found out that I have a cholesterol 214 and my other lipoproteins number are high and in risk category. What can I do to change all of those? Well, first, I want to know what your thyroid panel is. We're doing a special during this month of February coming up on the omega test. You want your omega 6 and 9 levels checked because you might be doing too many omega 6 fats. It's nothing to play around with. You want to dig deeper, go to our website during the month of February. We're going to have a special on the omega test, probably one of the best tests you could ever have done. I'm Dr. Bob DiMaria.